Hey there, I'm Shauna Dingman from Elevate Women's Health Center, and today I'm going to show you how to use the cervical traction unit or Denarol that I have prescribed for your care. If you are watching this video and you have not specifically been prescribed one of these by me, this video is not for you. This is only for my patients, only for people that I've specifically prescribed this, and I'm going to show you how to use it. So Denarol is the brand name of it. It's like Kleenex is a tissue. Okay, and what it's designed to do is to help use the weight of your head, to use gravity in the weight of your head to stretch out those connective tissue structures, the muscles, the ligaments, the tendons that right now are holding your neck, your cervical spine, in a bad position. If I've prescribed this to you, it's because you either are lacking curve in your neck or you have a curve that's actually grown, so instead of being a banana-shaped curve, it's grown the wrong way and it's going the other way. And if you don't use one of these, it's going to be very, very difficult to take the pressure off the spinal cord that is reducing some of the function that you have and in some of your cases, creating pain. So the first thing you're going to do is take it out of the box. So I would have already told you a little bit about this and why you need it. I would have shown you your x-rays, so you already know that this has to be placed in a very specific position. If you don't get the position right, and I'm going to monitor that with you, if you don't get the position right, then we can actually make the curve worse. So we're going to work together on that. So the first thing you're going to do is just take it out of the box. You flip this little tab, open it up. It comes in some nice plastic because it's brand new. Put the box aside. We're going to take it out of the plastic. And one of the first things that you'll notice about this is that it has two different sides to it. So this side looks different than this side. In this side here, I'm going to hold it up really close to the camera. You can see that it says shoulders this side. That means that this is going to go against your shoulders here, okay? So it's going to look like that. Now, I'm just going to place it on the table here. I'm going to show you how to use this on my chiropractic table. For you, when you're at home, you're going to do this on the floor. Don't do this on the bed or on a couch. It's too soft. So lie a yoga mat on the floor if you need to. If it's hard, or if you're on the carpet, that's fine. But you're going to put this right on the floor, and you're going to make sure that where it says shoulders this side, that's where your shoulders are going to go. So your feet are going to go down from here. So I'm just going to lay on the table, and just as a little tip, you're going to feel this is going to feel lower than it actually is. So wherever I've told you to put it, you probably want to feel like it's lower than that in order for you actually to be getting the right spot. Most of you are going to need to have this really low. So you're going to aim to almost feel it in between your shoulder blades. Like I said, it's going to feel like it's there, but it's not. So this is the easiest exercise you'll ever have to do. You just lie on it. I'll move my hair so you can see. So you want to make sure that the curve, the top part, the very highest part of the foam, this part, is right against the part of your neck that I told you it needs to be against. So like I said, for most of you, it's going to be way down low, right near that big knob at the top of your back. So you just push it way down here and you lie on it. So you can see that foam, that curve in the foam right there, is way down in the lower part of your spine, my spine. And in my case, I'm going to move it even further down. So I can actually feel the very tip of my head is slightly touching the table. That's okay. If you have a really long neck, I don't, but if you have a really long neck, you may need to just, put a little piece of washcloth or even put a folded washcloth underneath your Denarol. And all you're going to do is lie on it. Notice where my eyes are facing. My eyes are facing straight up. They're not over here watching Netflix or whatever else is keeping you entertained. It's kind of boring. You have to look straight up. If your head is tilted or turned in any different way, then you're not getting the right curve correction. Okay, so I'm going to sit up here. So you're going to start off by just lying on it for as long as you possibly can. It's uncomfortable. It's a really, really dense foam. So if I started you on the pool noodle, you're gonna feel this is a lot different than the pool noodle, but the pool noodle was just to kind of prime you to get to this. It can be really uncomfortable. So if you're feeling like it's uncomfortable, that's normal. Lie on it for as long as you possibly can and time it. You don't need to lie on this for any longer than 20 minutes. If you can do 20 minutes your first time, awesome. I should give you a prize for that because not many people can. But say you can only do 12 minutes. That's fine. Just make a note of it. And then what you're going to do is you're going to build up a minute or 2 minutes every time you go on it until you can get to 20 minutes. If you started out at only like 8 or 10 minutes, I want to get you up into that 20-minute range within 2 weeks. So it shouldn't take you any longer. You're just going to have to be consistent and keep working at it. If you can get to that 20 minutes faster, awesome. But try not to let it take more than 2 weeks. There is a tracking sheet inside the box. You'll see there's some instructions and a tracking sheet. So if you need to track how many minutes you're doing each day, just so you keep track of how many you should do the next day, that's fine too. You should be using this every single day. And depending on how severe the curve correction is that you need to make, you're probably going to need to be doing this most days, probably for the rest of your life. If you've got that change in your curve, it's something that your body is always going to want to pull back to every time physical or emotional or chemical stress comes into your body, which is, for most of us, most days of our lives. So, definitely every day when you're in your corrective phase, and then we're going to retest and we're going to see where you're at after that. And if I need to make a change to the frequency, I will do that. If you have any questions at all, this is a time to ask. You definitely want to be asking more than don't just assume, because like I said, we've got to get the location just right for this. Otherwise, we won't achieve what we want to achieve. And the other thing I'm going to get you to do is a week after you start doing this, I want you to bring it into the office with you on one of your visits and show me exactly what you're doing so that I can make sure that you're getting it at just the right point. So I hope that's helpful. If you have any questions right now based on this video, write them down and bring them in with you the next time I see you. I will answer them. Have an awesome day.